Good morning, ladies and gentlemen.
Good morning, doctor.
Do you hear me?
Yeah, we hear you. Good morning.
Good morning. Our chapter today is chapter 19, and it is going to talk about the urinary system. We mentioned yesterday this chapter, which is one of 11 chapters, as you know, and this is very nice to go through it and learn a lot of information and a lot of diseases, and we are like frequently asked some questions regarding the urinary system and complication of the urinary system. I wish yesterday lecture regarding the PowerPoint was nice and you enjoy it, and you have already the practice for the quizzes. And if you have any question, of course, let me know. What is the job of the urinary system? Number one, it is for excretion, and it has another job as secretion, and the third one is elimination. So what is the difference between these three jobs? Number one, excretion. It is the process of removing waste product. I would like to tell you guys that we have question in the exam asking about the waste product. The waste product which comes out as a metabolism of our body systems is either gases, is either solid, is either liquid. So we need to summarize the waste product which comes out from our body and how we eliminate it from our body. Like what? We mentioned gases. What is the waste product of gases? It is carbon dioxide. How we get rid of this carbon dioxide? We have two mechanisms. One, through lungs, when we do inspiration, exhalation. So this is one major job. The second is through the kidney. You will say that it is a gas. How gas come out from the kidney? I will explain this for you by converting this carbon dioxide to bicarbonic acid, and carbonic acid will be dissociated into bicarbonate and acid radical, and it will come out through the urine. So to get rid of gases, which is carbon dioxide, we have two channels. The first channel is lung, the second channel is kidney. Okay, what about the solid waste product? The solid waste product is going to be excreted out of the body through the fecal matter or defecation. This is the only route to get rid of solid waste products. It is through defecation. After that, we have another waste product, which is fluid. And what is the waste product fluid? It will be converted as a urine. When we filter the blood by the kidney, it will create urine. So urine is one of waste product, fluid waste product coming out of our kidneys. And how we get also waste product, it is only channeled through the urine? No, we have another channel which is through sweat. So when we get sweat, we get rid of another waste product which is in the form of fluid. What is the second job for the kidney? The second job is secretion. It is the process by which urine is produced. So what we mean by urine is produced? Because we have a component of urine, And this component of urine is not like just simply filtered from the blood. It has another conversion which will be come out at a process within the kidney. And the elimination, which is empty of the urine from the bladder. And this is also wonderful to be known, that elimination through voiding urine, or what we call urination. Okay, are you following? All right. We have two kidneys, and we are going to locate where the kidney, we have one on each side of the vertebral column. So the vertebral column in the middle of our back. So in each side of the vertebral column, we have our kidneys. And I told you yesterday that the right kidney is a little bit lower than the left kidney due to the presence of liver on the right side. Each kidney is covered with a tough fibrous membrane, and this is for protection and also to keep the kidney in place. We have another factor I need you to know is that how we keep the kidneys on place. Each kidney is surrounded by fat, and this fat keeps the kidney on position. Sometimes we lose weight, sometimes we did a mistake for making diet and we lose weight very fast. So this amount of fat around the kidneys will be absorbed. So the kidney will lose the support and it will drop a little bit down. We call it is toasted. Toasted means drop. Toasted kidney. And this toasted kidney is subject to be like produce a lot of trouble. We need to avoid it. As you see here, this is front view, and we have this lecture before, this picture before yesterday, that we have to identify the shape of the kidney, that we have a concave, this concave, if you follow my cursor, this is the concave. I need to be sure that the slides is working with you.
We just can't see your cursor.
Okay, but you see the slides?
You see the slides without your cursor.
Okay, because this is the option here, it is not working. Let me double check. Anyway, the inner side is the concave and the outer side is the convex. And through this concave surface, we call this is the hilum. And through this hilum, we will get the artery and vein and the pelvis of the kidney, which is the beginning of the ureter. So please remember, this is question in the exam, that the inner or the concave side of the kidney contains structure which is hilum. And what is going on through this hilum? Remember, it is a renal artery and renal vein and the ureter. This is very important. The ureter comes out through this hilum. And we know that if we look to the section of the kidney, we will notice that the kidney is subdivided into outer cortex and inner medulla. And the outer cortex, we have to know that it is very important. It produces very important hormone. When we talk about this was the suprarenal gland, we will talk about the hormone coming from the suprarenal gland, which is above the kidney. But for the kidney itself, we have external layer, which is cortex, and the innermost layer we call it is the medulla. And the medulla will going to be like subdivided into pyramids, and these pyramids like actually looks like pyramids. It has a base and it has an apex. The base and the apex will be like the papilla, and this papilla will open like joining together till we get the pelvis or the calyces of the kidney, and this will unite it together to make it the pelvis of the ureter. Each kidney has over 1 million nephron. So if I highlight this part, I need you to know that nephron is the unit structure of the kidney. So take this note. Nephron is the unit structure of kidney. We have millions of these nephrons, and they are like life preserving service of the kidney. Sometimes we have trouble that the kidney will start to convert into cyst. Some people, they have cyst in the kidney. So this cyst will replace number of nephrons, and according to this, the job which is like has to be done by million of nephron, it will be done by less number than million, so the kidney performance will not be perfect. And each minute, the kidney filter over 1,000 milliliter of blood. So each minute, we have 1 liter to be filtered. 1,000 milliliter means 1 liter. So each minute, the kidney filter 1 liter. And the kidney maintains a constant amount of fluid in the body tissue. And the rest is excreted as urine. I need to stop at this point. What this means? This means if I drink, as you know, our body weight is 60% of it is water. So water is essential to be part of our body structure. Sometimes we are suffering from dehydration, and we have to keep this amount constant. So in case of dehydration, the kidney will not function properly and the amount of urine will be decreased, which we call oliguria. We have this word in medical terminology yesterday. Oliguria means scanty urine. Polyuria means many urine, or the volume and the number is more. So we have to notice that we have a hormone, and this hormone coming from the posterior lobe of the pituitary gland, and this hormone controls the amount of fluid which we have to keep it inside our body. So if this hormone is absent, we will suffer from a situation which we call diabetes insipidus. So it is not true diabetes. It is watery diabetes. What is the watery diabetes looks like? People, they are completely healthy and they don't have increased blood sugar. So what the problem? The problem is they look like they have diabetes. They go frequently to the restroom to evacuate the bladder. Why? Explanation is very easy. Absence of antidiuretic hormone from the posterior lobe of the pituitary will make the kidney like not doing its job. Why? If I drink 1 liter of fluid, I will pass 1 liter of urine. If I drink half liter of fluid, I will pass half liter of urine. So what is the benefit? What is the benefit? My body got it. Got nothing. So I will suffer that my amount of water inside my body will be not constant. So what is the situation? If I have healthy antidiuretic hormone, if I drink 1 liter and my body needs 300, for example, 300 milliliter, so the body will take this 300 and the extra amount, which is 700 milliliter, will be excreted as urine. If I am in dehydration and I need all of this 1 liter of fluids, so I will not pass any drop of urine. So this is the benefit of this wonderful system, which is control the amount of fluids needed by our bodies. I hope this is clear. If you have any question before I move to the next one, let me know, please. All right. What about the nephron? The nephron represent funnel with long twisted tail. So this is the structure or how it looks like. Funnel with long twisted tail. We will talk about the details of this nephron very soon. The top of the funnel is called Bowman's capsule. Bowman's capsule. and each capsule contains cluster of capillaries called glomerulus. So sometimes we get patient with a disease we call glomerulonephritis. So this means what? These glomerulus with the unit of the kidney, which is nephron, are inflamed. So it is like more specific. Glomerulonephritis will be the disease, and it is characterized by hyaline cast and blood in urine. The blood enters to the glomerulus through an afferent arteriole. This is question in exam. So please highlight this word. Blood enters to the glomerulus through the afferent arteriole, and the blood is filtered, and after it is filtered, it will go back to the circulation through efferent arteriole. So please remember what is the difference between efferent and efferent. One with the letter A and the other with the letter E. So letter A going into, letter E going out. Beyond this Bowman's capsule, which is a twisted, we have what we call proximal convoluted tubule. And this proximal convoluted tubule will go to reach to the medulla portion of the kidney. So we have proximal and we have distal. In between, we have what we call loop of Henle. So this is the glomerulus like cup, like my hand. And after the cup, we have here convoluted tubule, mean twisted tubes on each other. So this will be convoluted tubule. And after that, we have loop, and this loop named after the scientist who discovered it, Henle. And we have another convoluted tubule we call distal. And from the distal tubule, we will get the collecting tubules, and these collecting tubules will unite it together to make, to open into the pelvis of the kidney, then eventually to the ureter. Very nice slides. I need you to pay attention for these slides. You see here, the red portion here, which is cup, this is what we call the Bowman's capsule. And we see here that there is an afferent and efferent artery. And after this Bowman's capsule, we have twisted tube, and this will be the proximal convoluted tubule. Then the yellow portion here, as you see in the little lower third of the slide, this is the loop of Henle. And after that, we have another convoluted tubules. Then it will lead to collecting duct, and the collecting duct will unite it together to make it much bigger till we get the ureter, as you see here in the left side of the slide. So again, I would like everyone to remember this shape. The Bowman's capsule and the proximal and the distal, and in between we have ascending and descending loop of Henle. Then we have collecting tubule. What about the ureters? Urine secreted by nephrons drop out of the collecting tubule into the calyces and enter to the renal pelvis, as I mentioned to you, and this will collect urine, and this urine will go down to the bladder. There is a question in the exam asking you, what makes urine go down into the bladder? There are two mechanisms. Can anyone of you guys share with me what you think the mechanism that make the urine go in this direction from the kidney down to the urinary bladder? Let us think together. Share with me, please.
Bladder is curved.
You try to explain it, Amy. Go.
I'm trying to say that the reason why it's going a certain way is because the bladder is.
Okay, how? What is the mechanism? Shirley, what do you think?
Ureters, sorry, I don't know.
Okay, okay. Don't, we don't need to waste your time. So let me ask you guys, what you think, Fena? What makes urine go from the pelvis of the kidney down to the urinary bladder?
I don't know, doctor. Sorry.
Okay, let us think together. Reen, what do you think?
You're asking what makes the urine go down, right?
Yes.
Let me think. Give me like 2 seconds. I don't know why, but I feel like it gets filtered, so it's getting pushed down. I'm not sure though. I'm just guessing.
Okay, Melissa, what pushed down? What is the factor that allowed the urine to go in this direction? Melissa, do you hear me?
Yeah, I hear you.
Okay.
What pushes down the urine?
Yes.
Don't we? I don't know. Don't.
Okay, okay, Israel. Israel, what do you think?
Is it the ureters?
Raise your voice, please.
Is it the ureters?
Okay, we say that urine going through the ureters. Okay, I agree with you, but what makes urine to go from this side to this side?
Gravity? I don't
Yeah,
know. Gravity?
you said what? Gravity, correct, correct. So this is number one. This is correct. This is the correct answer. Gravity. What else? We have another mechanism.
Muscles.
What are the muscles? Who is talking? Mark.
I want to say stuff in the ureter muscles, ureter wall.
Very good, very good. The smooth muscle in the ureter. You are so good, both of you guys. Israel and Mark answered the question perfectly. So we have two mechanisms to make urine go from the kidney down to the urinary bladder. Number one is gravity. Number two, it is the muscle or the smooth muscle within the wall of the ureter make propagation of the urine. Now, to the most professional questions. If you answer these questions, so you will be amazing. You said, Mark, that smooth muscle within the ureter will make this propagation of urine. What this movement named? It is only specific for two sites within our body. I will make it easy for you.
Contracting.
It is
contracting.
The contraction and propagation of this urine. We have similar one within our digestive system. So what this movement called? What is the movement of small intestine? We mentioned this before. Amy. What is the name of muscle movement or the small intestine movement? We call it what? We call it peristalsis. You remember? Peristalsis. So we have two sites within our body. This is very important question. And also, you have to, like I said before, that I'm preparing you to be ready for nursing program also after you're done with the MA program. So it is very important question in the nursing program, asking you about the peristalsis in our body present in where? And the answer should be in the small intestine and in the ureter. So urine go down to the bladder by two mechanisms. One is gravity, the second is the peristalsis movement of the ureter due to the muscle contraction, smooth muscle contraction within our ureter. I hope it is clear.
Can you say that word one more time, please?
Which word? Peristalsis. Peristalsis. Yeah. The movement name is peristalsis.
Thank you, doctor.
You're welcome, sir. So, peristalsis found in two locations within our body, within small intestine and within the ureter. It is very important to remember this, please. After that, we go with the urinary bladder, and the bladder is collapsible. What do you mean by collapsible? It is like balloon. If the balloon has no air, it will be collapsed. If it has air, it will be inflated. So it is collapsible means if it is no air, is no bladder inside, no urine inside it. And it has also muscular wall, which is smooth muscle, and this smooth muscle will contract. When we have a convenient condition, we know that this is easy, and we can do this, and we go to the restroom to evacuate the bladder or voiding or urination. So I need also you to build up your vocabulary to know that the word void urine means pass urine, means urination. So this is very common to be like remembered. Urine leaves the bladder through urethra, and this is question exam, and it is tricky for you. They give you the word urethra and ureter. So take care about the spelling. Take care about the spelling. And this spelling is very important to answer correct. Urethra and ureter. Both of them start by U-R-E. So don't be like in hurry and take it like light and did the mistake. So leave the bladder through urethra, going into bladder through ureter. I hope it is clear. What about the urethra? As I told you, from this point, the male and female will start to be differs. In female, the urethra is 1.5 inch long and open externally between the clitoris and the vagina within the fold of the labia minora, and the opening is called meatus. This is another question. Opening of the urethra to the outside, it is meatus. Either it is for male, either it is for female. The opening is called meatus. And the female urethra is 1.5 inch. Of course, we have congenital abnormality. What do we mean by congenital? The baby born with something like that. So this meatus may be varies in location. Normally, as we see here in this slide, normally it should be between the clitoris and the opening of the vagina. But sometimes we have abnormality. What is the abnormality? It may be above the clitoris. It may be below, to the either side of the clitoris. Of course, in this situation, it is not problem at all. If it is open, Above the clitoris, no problem. Open to either side of the clitoris, also it is not a problem at all. But the problem if we have such abnormality happen to the male, so instead of opening in the terminal part of the penis, it will open to the dorsum of the penis or to the ventral surface of the penis, and this is what we call hypospadias or epispadias. If hypospadias, if it is open to the undersurface of the penis, or it will be epispadias if it open to the dorsum surface of the penis. Of course, in this situation, this is a problem. This problem will be only for men. It will affect a lot of activities for the act of urination and sexual act. So it is very easy operation, plastic surgery. It will be like detected and it will be like done very early in life, and it is very easy to be recovered and without any residual problem. But if we don't treat it, it will create some sort of problem to the male, and also it may be one reason of infertility in males. So this is just for your knowledge. How the urinary system function with other body systems. Of course, we have a correlation between all our bodies. So what is the relationship between our urinary system and digestive system? The digestive system deliver waste products and other substance to be excreted as urine, like fluids. Extra amount of fluids will be going to be excreted through the stool and also through urine. And the muscular system provide what? This peristalsis. As you see, Mark, this is the word which you were asking. Peristalsis, which kind of muscular system? Of course, smooth muscle, not any other type of muscles. And again, I refresh your knowledge that the muscular system may be smooth, may be skeletal, may be cardiac. Of course, we are talking now belong to smooth. All right, what else? The nervous system, which is very common question. How is the nervous system control or has a relationship with our urinary system? It is by cooperation with the muscular system to control elimination. Of course, we have control, or the majority of people, healthy people, they have a control on when or how they void urine, or they control themselves till they reach to the restroom and so on. But like babies, newly born babies, their nervous system is not well developed, so they pee or they urinate on themselves. And also for old people, they have like neurological problem, or they have atherosclerosis or dementia. Also, they don't have control on their urine, and we'll talk about this disease later on. So the two extremities of age, too young and too old, they don't control their urine, so they can reach their restroom a little bit tardy, and they can't hold urine all the time. What about the respiratory system? As I told you, carbonic acid, which is the mixture or the dissolve of CO2, carbonic acid, with water, it will produce carbonic acid, and this carbonic acid will be subdivided or dissociated into acid radical and bicarbonate. So this acid radical will get out of the body through the urine. And this is why when we are notice patient with acidosis, so what is the word acidosis? Increase the acidity of the blood. And this will be a harmful situation. And when we have patient with acidosis, it is secondary to lung problem. If the lung is not working efficaciously, so we cannot eliminate carbon dioxide perfect from our body. So this will be accumulating within our blood, produce a situation which we called acidosis. So the kidney will compensate for this acidosis by increasing the secretion of the hydrogen ion or the acid radical to minimize the acidity of the blood, and also by the bicarbonate, it will neutralize the acidity of the blood. So this is very important as a clinical point. People with lung problem, they have acidosis, which means increased acidity of the blood. Any questions so far? So take care of the nervous system and respiratory system. This is question exam, and it will be wonderful for you to get correct answer. What about the endocrine system? It has a relationship with, yes, produce hormone that influence the amount of urine excreted. If I ask you again, what is the hormone? I mentioned to you, Melissa, early in this lecture, we mentioned it is what? Can you remember?
What? Mention.
Alex, can you remember what is the name of hormone that affect the amount of urine excretion? Alex?
It's I'm not sure.
Who is sure, guys? I mentioned this earlier. Malaya, can you remember this, Malaya?
Is it anti-diarrhea?
Very good, very good. Antidiuretic hormone. What about the integumentary system? The integumentary system also remove or retain body fluids as required, as we mentioned, in case of dehydration and in case of overhydration, sweat. We are going to talk about dialysis, and this dialysis is what? This dialysis is the technique that we can use artificial kidney to eliminate the waste product from our body. So this dialysis can be of two types. Hemodialysis, like this machine, hemodialysis, and we have another one which is peritoneal dialysis. Both depend on what? We filter the blood from the waste product, and according to the severity of the kidney impairment, we can make it like this dialysis happen once a week or twice a week, or in severe cases 3 times a week. So this is very important for us to remember that what are the types of dialysis. Hemo means we are using artery and vein. This is more common. Peritoneal, this is another technique, and this peritoneal is the subject which we use for people with chronic renal failure, so they can do this job of dialysis at home. This is like very annoying and very poor patient. I wish everyone to be safe and cure for all people, because these people, I have friend, and this friend has this dialysis at home, which is peritoneal dialysis. He has a kidney failure and he is waiting for kidney transplant. So I notice how he's working like this machine. At night, he connect the 2 tubes to another 2 opening inside his tummy or abdominal cavity, and he leave the machine working overnight while he is lying on his bed. So it is, of course, not convenient. It is very hard for him. So this is how is the kidney are very precious. All our organs, all our systems are very precious and it works a lot. And he is like trying to do this job day after day till he get his list ready for transplant.
Doctor, I have a question.
Yes, Emerald.
The hemodialysis, so she goes in every 3 times a week. I mean, she does it for like 4 hours at a time. Now, like, how do I mean, I'm assuming you can't be on dialysis forever. Is there like a certain point where it gets better, or it's just forever going to be there?
Of course, it is much better to go by transplant, because if we don't have the option for transplant, so they have to keep it for forever, because um, the kidney function will be like elevated, and the enzymes will be elevated, and the blood urea will be elevated, and this will make a lot of trouble. So we keep people for dialysis in two situations. If we don't have a chance, like in certain countries, they don't have the opportunity for kidney transplant. So they have to keep patient on dialysis forever. And another option, we keep the patient on dialysis like temporary till we get the chance to implant. And this is also much better, of course, just doing implant, and we be sure that the kidney is not rejected, and it will be much better. Otherwise, they have to keep it on kidney dialysis for forever. Okay. And we mentioned that kidney transplant is nowadays is very successful operation, but it is like long waiting list, and we have a lot of precaution to avoid immune rejection, or we have to give patient immune suppression to prevent the rejection. So also, like, we put the patient for 1 year at least under supervision or strict supervision to avoid an infection till we be sure that the kidney is working without rejection and everything come back to normal. Of course, kidney transplantation is much preferred than dialysis for easy and convenient and more efficacy uh, for the procedure. After that, we are going to talk about how we diagnose kidney disease. And one of these kidney disease procedure to be diagnosed is either by invasive. Invasive means we penetrate or we get inside the body. We call invasive. And another one which is non-invasive. So I'm not going to penetrate the patient body. Like what? If I use ultrasound, I'm not going to harm the body by penetration or give injection or give cannula or give cystoscope. So this is non-invasive. But if I do like give injection, give cystoscope, give implant of stent, so all of these are invasive. So remember these two words, invasive and non-invasive. X-ray is non-invasive. Ultrasound is another non-invasive. So take care of the description, because this is also a question in the exam asking you about invasive and non-invasive technique, which one you have to choose from the multiple choice. Sometimes we are going to talk about routine specimen, and this routine specimen, like we learned together how to perform urine analysis. Of course, if I go to the lab or if I do this urine analysis at home, if I have the strip, so it is not invasive. I just collect sterile sample and we use it. And we watch it together, if you remember, through the class, how to collect clean catch specimen and what are the points we have to pay attention for collecting such specimen, and how to make it like sterile, and how we go by the steps to record the changes with dipstick like what is the time for glucose, what is the time for nitrate, and so on. Another non-invasive technique, which is 24-hour urine test. What this means, we ask the patient to collect 24-hour urine. How? This is the question, and it is some sort of fun. How? Because sometimes people, they don't have this experience, and maybe they don't have wonderful medical assistant to give them instruction. So they hold themselves holding their urine 24 hours, and this will be very, very annoying. Of course, you can't hold your urine for 24 hours. So what should I do? I have to collect urine. What is the procedure? The procedure is number one. We ask the patient, for example, I need 24 hours for today. So what should I do? In the early morning, if I woke up in the morning, I void urine. So all of this urine which I voided is from previous day. And while we are or I am sleeping. That's it. Okay. And I notice it is what the time, it is like 7 a.m., for example. So it is 7 a.m. on Tuesday, January 5th. Okay, and I voided the urine. This urine, I'm not going to collect it. So from 7 a.m. Tuesday, January 5th, till Wednesday, January 6th, 7 a.m., all of this urine will be 24 hours. Clear? So what should I teach my patient? When you woke up in the morning, void your urine in the toilet. That's it. Then after that, any amount of urine will be coming out has to be collected in clean container. But I have to divert attention to my patient to keep this urine in wonderful or better atmosphere. So I have to cover the bottle for collection of urine, and I have to keep it in refrigerator. Why? Because if I keep it in room temperature, this urine will be like decated. It will be decated or denaturated. What we mean by the word denaturated, it will not be nature. D means without or no. Nature, so it is not the nature of urine. As you know, sometimes, guys, if we pass urine, urine has no odor, for example, or it is uriniferous odor. And if we leave this urine for a while, it will change its odor to be like ammonia odor. So why? When we void urine, has no ammonia odor, but after a while it will develop ammonia because what we call denaturation. So if we collect sample of urine, we have to keep it closed container to avoid contamination from the atmosphere, and also we have to keep it in a refrigerator to prevent denaturation. So this is what we call 24-hour sample, and after that we carry it to the lab for testing. Another non-invasive technique, which is X-ray to the abdomen and ultrasound, as we mentioned. And of course, X-ray will give me shadow of the kidney, shadow of the ureter. It is just shadow. It is not going to give me details of the soft tissue. But we are using this X-ray as an easy technique, non-invasive technique, cheap technique. Maybe we can detect stone, and this stone may be opaque, maybe non-opaque. If it is opaque, it will be very good, and we can detect the stone within the kidney or stone in the ureter. But if the stone is not opaque, so it will give shadow, not very clear. So we have to go by another technique, which is invasive. We will talk about this later on. So ultrasound also will help us to diagnose kidney problems without invading the body. After that, we go by the invasive technique, And this invasive technique, which we call intravenous pyelography, IVP. IV means intravenous. P is for pyelography. And this pyelography should be taken into consideration because people may develop allergy to the material which we are going to inject to the body. So we have to ask them about any allergic history, and we have to be ready when we give this medication to patient by all the emergency condition that maybe the patient develop anaphylactic. Another technique which is invasive, which is cystoscope. Cyst means the bladder. Scope is to visualize what we are seeing. So we see what? We see the internal lining of the bladder. We will see the trigon we mentioned yesterday. We will see the orifices, which is like maybe there's a polyp, maybe there is a stone, maybe there is like stricture in the orifice of the bladder, ureter into the bladder. Another invasive technique, sometimes patients, they have enlarged prostate or they have a stone and they cannot pass urine. So we introduce catheter. So sorry. We introduce catheter, and this catheter will go inside inside the body, inside the ureter, inside the bladder actually, and it has a hole, so it will drain the content of urine from the bladder to outside. Sometimes this catheter can be like retained. We keep it for a long time. Sometimes we are doing operation or patient is like comatose, and we insert this catheter, and this catheter has a balloon to retain the catheter inside the bladder to drain urine all the time. But sometimes we use the catheter once in case of like emergency, and if we don't need it for longer time, we will remove it. Catheterization. Some of the disease which affect the urinary system, this will be our next lecture tomorrow. We are going to talk about a lot of disease affecting the kidney and affecting the bladder, affecting the ureter, and also the prostate also can affect the urinary system. So for today, we will stop at this point. We finish everything except the diseases which affecting the urinary system. If you have any question, you are so welcome. I am already posted for you the quizzes and the PowerPoint. Tomorrow, God willing, 10 a.m., we will meet again to have the remaining part of our lecture. I wish everyone wonderful the rest of the day, and keep yourself safe, and keep others also safe. Take care and see you tomorrow. Do you have any question?
Have a wonderful day.
You
Thank you,
say.
Doctor.
Thank
Bye.
you, guys. Thank you.
Bye, doctor.
Bye-bye, ma'am. Thank you. You have question?